Hi, and welcome to the Soul and Survival podcast with Grant and Louise Bentley. We have run the Victorian College of Classical Homeopathy since 1995. We are both qualified practicing homeopaths, and Grant is also a naturopath. Together, we discovered a link between energy and facial structure based on traditional ideas from homeopathy that have roots going back 200 years. This project is called Homeopathic Facial Analysis, or HFA for short, and has been the cornerstone of clinical diagnosis and training courses since 1999. Between us, we have written and produced 7 HFA books, including Soul and Survival. Soul and Survival is the philosophy of energy influencing matter and how this energy forms individual facial structure, our unconscious drives and fears, our life patterns, and universal time cycles.
Well, hello everybody, and welcome again to the next instalment of the Soul and Survival podcast. It's been a couple of weeks and since I've had my regular co-host Louise with me, so welcome to you. And
Thanks, Grant.
What, as always, questions. Just fire away. I think that's the easiest way to do it.
Well, I was having a read of the summary we did, I think, of podcast 12, which sounds so interesting. I feel like we must listen to it, Grant. But anyway, you're talking about the challenges of quality and harmony within the brown miasm and brown miasm in modern society, and, this link between the history and the cultural evolution of miasms, all fascinating topics. But I just thought, I know you deal with so many children in the clinic, very busy clinic, by the way. And my question is, in what way do you think the miasm influences children? As in, what do you see coming through the clinic miasmatically when you're dealing with things like PANDAS, etc.?
I don't think that there is a difference between, say, a red child with PANDAS versus a brown child with PANDAS or anything like that, essentially because the pathology is so dominant. I don't see vast differences like that. I mean, there are subtle differences, I suppose, but essentially when you're dealing with a topic like PANDAS, the inflammation of the brain creates really predictable outcomes. It's sort of like saying, in a way, what's the difference between a red colour group arthritis versus a green colour group arthritis? Well, the answer is not really all that much. Mainly because the pathology and particularly the more dominant the pathology, the more lost the personality. And so in the end, you end up only with pathological symptoms, and that can be a real problem. And that's what I'm trying to do when I take a case, is that I'm trying to find some spark of individuality in there. I know that people, when they fill out their performers for me to have a look at to treat children with PANDAS, that they probably are thinking that, the PANDAS, that, the symptoms that are happening to their child is pretty unique, but they're not. Things like the rages, the OCD, the tics, the fear of separation, even some physical things like blood noses and, not being able to, particularly for boys, urinate into the bowl, all these sort of increase in the almost a morbid desire for urination, never feel like they're finished. For girls, there can be what they call a phantom wetness, where they feel like they need to wipe and wipe and wipe. And all these things, I suppose, to a person that has never experienced these sort of things seem really odd and characteristic. But the whole reason that I can sit here and give you this list of symptoms, and there'll be mum's out there or dad's out there going, well, that's my child, you know, tick, tick, tick. Well, that's all part of that inflammation. And the more dominant those symptoms are, the more lost is their nature. And it's being replaced by a pathology, which is really kind of, you know, going back into traditional homeopathic literature. You have authors like Kent, for example, when he writes his repertory, you know, the reason that he says you should never begin with the pathology because you're automatically wrong or you're automatically lost is because you're losing that individualization with the patient.
No, it just brings up so many thoughts in my head and questions, and I understand what you're talking about, but if I was to explain this to somebody else, I would struggle, because we know that you're treating the pathology, as in the parent wants the pathology gone. That's the whole purpose of giving them treatment.
Yeah.
But you're not using that information all that specifically to choose the remedy. You see it common across many children. You see it common across the miasms. So why do you think that's common, and where do you actually look to find what is individual so you can choose a remedy that resonates to them?
Well, you know that with PANDAS, even though with the most sophisticated equipment at the moment, you can't really register where inflammation in the brain really is. I mean, there you can sort of see some hot spots, but there is going to be a commonality to the location of that inflammation when it comes to PANDAS, because you can tell by the consistency of the symptoms that they're suffering from. So the more that a pathology is uniform in its symptoms, you know that it's affecting the same area in the same way. In reference to how I choose, well, you know, this is really where the facial analysis is just vital, and people don't get how important it is, because, you know, you can tell by the pictures that we get, the photos that we get, that even though we give explicit instructions, you must do it this way, you know, the amount of times we get that way delivered to us would be about 1 in 10, and I need to really eke out the information. But what people don't understand is that, particularly when their pro forma has got things like what we just mentioned, diagnosed with PANDAS or diagnosed with PANS, rages when things don't go their way, addicted to screens, craves sugar, you know.
So tell me, what are you looking for that's individual? What kind of information you would say, well, that's gold, that's going to help me find the remedy?
Look, a lot of the time it can be if a fear is manifested onto something specific, like, for example, there might be they can't go to sleep at night because they feel that demons are going to possess their mind. It's actually less specific than what you think, but it's not as common in the case. So it's not uncommon, but it is less common. Most of the time, though, and this is where, when you look through Hahnemann's writings, particularly the 6th edition of the Organon, where he really highlights how to bring out a PQRS symptom, and what he's talking about with, you know, to elicit the PQRS symptoms that you need for a case. You need to get, when a person has a symptom, you get them to stand up, walk around, drink hot drinks, drink cold drinks, whatever, and to figure out what is making them better or worse in the proving. Now, what you notice there is that the main thing is the generals, you know, the better falls and worse falls. they're the ones that I'm really after. The problem when you're dealing with, say, something like PANDAS is that it's really hard to find those. The other thing is that until parents become trained in the system and know what I'm looking for, well, they might exist, but they're just passing them over.
Look, we do have it on the Performer. There's a big sort of describe the main complaint. And,
yeah, but they're not looking for it at that
then
stage.
there's a whole list, which essentially is what you're talking about, environmental modalities, meaning your special relationship with temperature, with time, with perspiration, with the moon, with food, with drink, with touch, with all these sort of more natural things, not the unnatural things in life, but more the natural things.
Because in every case, this is where I guess it becomes really important to understand where homeopathy works and why we need certain symptoms. Is because in every case you've got two sets of signs and symptoms. The first set is a set of symptoms that belong to the pathology itself, what's going wrong with the body. But the body just doesn't sit there and allow something to go wrong. It always tries to fight back and rebalance. And those rebalancing symptoms are the ones that belong to the patient. Right? They're the ones that are more individualised. So, pain in arthritis, does that belong to the patient or the pathology? Well, it clearly belongs to the pathology because it's a result of the inflammation of the joint that's taking place. Pain in the joints, which is worse for drinking coffee or is better for putting a cold compress on it, well, that's not everybody. Or if it wakes them up, if they end up waking up with a headache at 11 o'clock at night, you'd turn around and say, well, what are you taking that for? What's that got to do with arthritis? And aren't you trying to treat arthritis? Yes, but not everyone with arthritis has a headache at 11 p.m. And that individuality shows me what the body is trying to do, at least at some level. Now, I can't necessarily interpret what the body is trying to do. I just take it at face value. It's a unique symptom, so I put it in.
And if there's only 3, 4, 5 remedies that have been proven to have those particular symptoms, one of those remedies is more likely to be effective for the case, and most especially if the miasm of that remedy and the miasm of the patient via facial analysis match.
Yeah, the facial analysis, though, is absolutely vital, and this is why I stress that those pictures must be perfect. They have to be picture perfect. Because essentially they are our X-ray, and if you're bringing your X-rays to a surgeon, you don't want smudgy bits and moving, right?
That's a good way of putting it.
You want them to know exactly where to cut, and that's exactly what it means to me. It can, lousy photos for a parent can cost them months of me trying my best, but I often select more, and sometimes they come back even worse. Sometimes they come back better, and straight away, if you get the better photos, you can do it.
Yeah, it's interesting, isn't it? Because the kids are difficult, let's face it. That's why they're coming to the clinic. They often don't sit still. They don't cooperate. But I think people are a little nervous. They just do it very quickly. They're not just taking their time to set the photo up, to get the patient sitting up straight.
Well, they don't understand what the photo's for in the first place.
We do say, but to reiterate, what it's for is the energy within you, the way you respond to stress is reflected in the structure of your face. So we can measure the face and come to the conclusion of which of those 7 groups, we all belong to one, is dominant in the facial structure. Therefore, it is how your body responds to stress. Therefore, the remedy needs to also have that energetic imprint within it, its own miasm. So it's really vital because you can start getting into a case very quickly with a good set of photos. It can be really, really helpful. And, you know, that's a positive thing if people can really follow those instructions. We do, you know, we update them every now and again. We try to be very helpful when we get a set, and usually it's the profiles. Look, there's 3 photos out of the 9. The smile's nearly always fine. The teeth are okay. Pre-braces shots are really helpful as well, because that's what nature intended, even though the orthodontist has changed that. The frown photos are not too bad. People seem to follow those quite well. It's these very specific ones. The front on, where you're measuring asymmetry and you want it to be really sitting well on the screen, like very centered and looking straight ahead. And the profiles, of course, the most difficult of all. But look, people are pretty good. We give them some feedback. We compare a good photo to a not so good photo, and they slowly get it. And usually within 2, 3, maybe 4 tries, we've ended up with a reasonable profile, and then you can do your analysis.
So going back to what you were saying then, what the original question was, which is what does a miasm mean in children? Well, mainly from a pragmatic point of view, it's exactly the same as adults. I take the signs and symptoms, the ones that remember that there are disease symptoms, and then there's the body's attempt to balance itself. I try, and the more that I can get a set of symptoms of the body's response rather than the body losing the fight, which is all that pathology is, the more that I can get the way that it's fighting back, the better. And because essentially what we're doing is that we're doubling up on the body's ability to be able to heal itself, or at least its attempt to be able to heal itself. Where the miasm comes in is that each one of these colour groups, as we call them, or miasmatic groups, is that everything is about defending the inner core, but Group 1, for example, the yellow group, will expend a fair bit of energy pushing that any infection or any pathology out to the surface as best as its energy will allow, whereas, say, the red group will try and encapsulate or imprison it so it doesn't become systemic and float around the body and maybe get to these vital inner organs. So what you notice is that the remedies all have a course of action as well. And when we match that course of action of the remedy to how the body is trying to heal itself, then we're doubling up not only on the signs and symptoms that a person is presenting with, but the pathway in which the body has decided is best to do it. And that's essentially what HFA is all about. That's why we get these better results. That's why it's quicker if we can get it. If we get onto the right photos, some good information, we can absolutely get it. But, you know, sometimes getting that information's really difficult. Parents don't know it because they're not looking for it, and sometimes the pathology is so deep that there's no healing signs anyway. It's almost as if the body's given up and has been taken over just by the pathology. So, you know, you don't see some of those more healing signs until they start improving a little more. And then we can see some, and that will alter a course of a remedy. But if we don't have what we want, then we have to do what we think is best. And so sometimes we have to start with the second best remedy because we just don't know what the best one is.
But you're not going to know that until the outcome. You never know what a remedy's going to do in advance.
That's why we always ask people to give us at least 4 goes. Yeah. So, I mean, some people will give you 1 and, you know, then there's finances and there's all sorts of things that come into that. There can be public pressure, particularly family pressure, that this is a dangerous situation and this kid's going crazy. You need somebody. You know, you need to go to a doctor now, you need to have all these, and this is not the time to muck around.
And yet, realistically, every patient, every child that comes in is also been to the doctor, has gone through it all. It's not,
absolutely.
It's very rare that they choose you first.
Yeah,
it's
no,
more
they
likely
don't.
It's at the end.
They don't.
There's no risk.
They don't choose me first at all. But That doesn't negate the pressure that can
Yep.
be placed on parents, though. When you start going outside, of we'll do quote unquote norm, that can start becoming really difficult for people. So anyway, by and large, though, the people that have come to me are coming via recommendation. And so as a result of that, they're not too bad. So we'll go back to your question one last time, is that miasm in children, this is sort of, I've got an interesting thought about that I think that miasms in children are formed, the potential is formed just before conception. So whatever is going on in that month or so around the conception, I believe, because...
As a stress, you mean?
Yes, well, the female ovulation is every 28 days. Well, we'll just call it a month, and inside the body, the sperm lasts for around about 21 days. So anywhere but... or inside the body, yeah. Inside the male body, mate, not the female.
I was going to say, I think it's only active a couple of days.
No,
in
that's
the
right.
female
That's
body.
right.
Yeah.
No, in the male body.
Yep.
And so what we're looking at there, though, is that the moment that conception takes place, it's not only all the genetic information that is swapped, but I think there's also information swapped about the outside world and what it is that this new child is coming into. The survival instinct, or the vital force as we call it, that survival instinct is all about dealing with danger and stress. And, this is why the information that is swapped will include that. It has to include that. Otherwise, the child comes in completely unprepared. I think there are 3 levels of consciousness. This is not in a baby, of course, but if you take an adult, then you've got 3 layers of consciousness. You've got consciousness itself. You've got the subconscious, which is all the things that your brain decides is not worth committing to memory, or all the things that you want to suppress or repress because you just don't feel it's either valid or you don't want it as part of your life.
And your automatic functions.
Yeah. And also to then the third part of it is, so all those suppression parts, that's what psychotherapy deals with, and this is what Jung and Freud and so on are talking about. But I think there's more than that. There's an unconscious, and this is where your bodily functions really come in, not so much the sub, but the unconscious mind. And the unconscious mind's just, you don't have to, it's a program. It's beyond you. You can't even reach it with your conscious mind. And part of that unconscious is the swapping of, this is where the colour group lives, right? So when we're talking about the what does the miasm mean, then it isn't just a way of defending yourself. It's a whole lot of fears, a whole lot of phobias, and so on. And so what happens is that I think past generations, every stress, every sort of fear, condition, all of the dangers that have happened to people within a particular colour group, particularly within a colour group time frame, are then handed down to each individual in their unconscious. But then what happens is that the stresses that you have to endure along the way act as the epigenetic triggers as to what aspect of that red or green or yellow survival instinct get triggered. So behaviour is, and like what we were saying earlier, is that when you're in this fight or flight response, the problem with that is that all of those defence mechanisms get triggered. So when you're going back now, when conception takes place, I think the person who is under the most stress at that time,
The parent. Which
the
parent?
parent that is under the greatest amount of stress gets to choose the colour group of the child.
And the stress that they're going to be both most sensitive to and potentially stronger with as well.
Yeah.
Like it's a dual-edged sword, isn't it?
Yeah. So the father, let's just say it's the father in this instance. He's going through, a really crappy time, and work's not good. He's maybe abusing alcohol. Maybe, who knows? The circumstances don't really matter. The point is he is in worse shape than the mother. Well, in order for the child to survive, the survival instinct says, well, if this is the type of environment that we're going to be born into, this is the colour group that will best cope with that environment.
Can you give some examples, like comparing 1, 2 or 3 colour groups with another?
Well, look, I'll give you one just off the top of my head. One of the colour groups is that when it's not uniform, but I have noticed that women who had a lot of trouble conceiving and were really worried that they were not going to be able to conceive have a greater number of red children.
Interesting.
Right, and because fertility, when you look at the red remedies,
It's a theme, yeah.
is a theme. And so what I'm saying is that the mum in this case is the most stressed of the two.
It doesn't matter if it's a boy or a girl.
Doesn't matter if it's a boy or a girl. More commonly girls though. But it doesn't matter if it's a boy or a girl. And the red group, which has got a lot of that fertility and dash infertility in it as a theme, the child has a tendency to be born within that colour group.
Because the mother
was
concerned about fertility.
Yeah, and so it's an issue. It doesn't matter what side of the coin we're talking about. It just matters what the issue actually is.
So give us an example of another colour. What's something? I know this is really simplified, but it's interesting.
It's very simplified, but I have seen again people who were undergoing huge financial stress. One that I can think of was a business collapse that they had built up for a long period of time. The business, I mean,
not the collapse. And then it collapsed.
It collapsed. And they were just under terrible financial stress. And their 2 children that they sent to me, because this financial stress was going on for quite a long time, were both, and they were both about 18 months apart, I think. But they were both yellow.
Yeah, which has a
has a lot of the money issues in it.
It's not exclusive, but it's
dominant. It's not exclusive.
Like you can have fertility issues and be in another colour group, but there's these tendencies, these dominant tendencies.
Yeah, well, what it is that there's just greater odds. There's no exclusivity the same way as there's no exclusivity in anything to do with life. But when you're talking about greater odds, then yes, there are greater odds in, say, the theme that is going to be the most impacting emotionally
on one of the parents, if not both. Yeah. What about, can you think of one of the other, there's 7 colours. I'm not even sure if you've taken it this far. I know we ask on the child proforma any issues at conception, and some people will put things, others just leave it blank. People don't think in those terms, obviously. You don't really over-examine your life. You're generally in your 20s or 30s. There's a lot going on. You're working, you've got family issues, you've decided to have a child, or maybe it's a surprise. There's lots of different things going on. But have you seen another colour that you'd say, look, a little bit more than average? This colour,
not off the top
they're
of my
two.
head.
They're the two.
If I was doing a seminar or something on that, I'd have to research through.
Mm-hmm.
But off the top of my head, I always I remember these two, and mainly because I was aware of it because of the red group. I'd seen that a few times, because that's a physiological condition or a worry to a lot of women that this is going to happen to them, so they will come to someone like myself to see if we can help them out. So whereas if somebody's suffering a financial loss, they generally don't go to a homeopath. It's just that they had been previous patients and they understood about the constitution and the need for me to be able to support them through this terrible time that they were having with their business. And so that's really how I got to learn about them. But that doesn't necessarily mean, though, that the children of those, let's stick with the red group, we'll stick with the fertility-infertility, that the red children are going to have that as an issue. It's just that red colour group is the one that is overall best able to deal with all of the stresses that come from that as the theme, the cause of the stress. But what happens in their life now, the temperament of the parents, and also too there are two aspects to life too. So first of all, let's just deal. So the environmental conditions, the family conditions, all of these will act as epigenetic triggers. So it doesn't necessarily mean that every child born of red parents has got fertility issues, even if the mother had fertility issues.
Well, it's not even red parents, it's every red child born of stressed fertility.
Yeah, so
energy.
It's really important to understand that. So they can have varying personalities and varying fears.
And
it's
issues.
Just that was the the central fear at that time of conception. Survival instinct goes, well, look, if that's what we're facing, then this is the best colour group to come out into the world having, because this is your best protection and your best armour. But then, life happens along the way, and when we talk about the red colour group, there might be, I don't know, we're talking about 10 billion bits of information, and which ones are going to be triggered to form a personality depends, and personality can change too, it can change a little along the way. Depends on the effects of the stressors, but each one of those stressors will epigenetically open the door to a red counter response.
And it can be one of many different red counter responses, but the bottom line from a homeopathic point of view is that patient, no matter whether they're 2 or 22 or 42 or whatever their age, you can tell from their facial structure they're in the red group. Therefore, you look at the totality of their symptom presentation, meaning the symptoms that are more, as you say, the body's best response to fighting back. If you can find them, they're a little harder to find, but they're there. They're there if you ask the right questions, and the person observes and thinks about the answers, the patient's parent or the patient. But the reality is that person will always need the red remedy. It'll do better than any other remedy. You might give them something green or blue or yellow or whatever, and it might do a bit. It's not uncommon.
And it's a filter, right? It's a set of glasses. Red-coloured glasses means that you're going to be looking every day of your life with a red tint at everything. There's no right or wrong in that. It's just that you're going to look at it from a red perspective.
And same for the other 6.
Yeah, and same for the other 6.
Well, that's a nice place to end. What do you think?
Yeah, no, that's fine.
Okay. I know we're a little pushed for time today, so it's a little bit shorter, but it's just nice to have a chat about these things.
All right. Okay. Well, thank you, everybody. I hope you enjoyed it, and we'll catch up with you next time. Okay. Bye-bye.
Thanks, Grant. Bye-bye. Thanks for listening to Soul and Survival. If you are interested in more information, books, courses, consultations, learning more about facial analysis or life themes, please visit our college site, Victorian College of Classical Homeopathy, vcch.org.